Good afternoon and welcome to Facebook Live. I'm Dr. Bill Bird, Chief Medical Officer at CGH Medical Center, and thank you for joining me on this broadcast. So, here's what we have on the docket for today. We're going to give you some facts, some news, some analysis about COVID. I'm going to give you some bonus medical information about some interesting medical things happening research-wise outside of the COVID world. I'm going to do some employee shout outs and we'll wrap it up. So let's start with our graphics as usual. Matt, I'll let you put those up there. So top left are cases week over week. They're even. But overall, if I remember right, we were in the 150s, 170s at one point in time. And it looks to me like that's 73 there on both of those. So that's good. And then the bottom left graph is the 2 weeks. The last 2 weeks is red, and then 2 weeks prior to that is blue. And you can see our trend is in the right direction there. On the right there, particularly the bottom right, is kind of those surge numbers that kind of get those bars that go up tell you how many cases we've had. And you can see the different surges. And this particular surge, it looks like we're trending in the right direction in terms of number of cases. So that's encouraging. What's next, Matt? Yes, we've begun to show this too. This is from the Illinois Department of Public Health, Illinois Hospital Association. The top is a number of COVID cases. And that second paragraph is how many individuals are in the hospital, 1,229, which is definitely going down. And 142 patients are on ventilators, which also is going down. So encouraging numbers. The state 7-day positive rate is 2.2%, which is about the same, if I remember right, from last week, but definitely better than it was during the middle of this Delta surge. Was around, I think, 5 or 6%. And around by the way, the initial surge last November was in that 25% range. Vaccines in the last rolling 7 days there, that bottom paragraph, 41,413. That's definitely popping up. I think it was 30,000 last week. And I have to think that most of that is related to people that are getting booster shots. And then on the right there is the number of daily cases in the country, which is 68,000, which is also on an encouraging trajectory. And the number of deaths, which is not so encouraging, but that's, if we have fewer cases, we have fewer deaths. So anyhow, let's see here. What did I want to do? Oh, news. Yes. So let's do news now. My bad. That was a fact. And I'm going to do some more facts. So not tons, but just to confirm that right now the CDC is saying that this Delta variant is still greater than 99% of the cases that are happening here in the US. Another fact, this came from a question that one of our viewers asked last week, which was, do you need to wait to get a booster shot if you've recently had a COVID infection? And the answer, from what I can gather, is that the answer is no. There's no restrictions in terms of, there's no restriction. And this was the answer I got from the CDC was more about like having an initial infection, and then for unvaccinated folks, if there's a reason why they wouldn't be any time frame of when they can get vaccinated. And they said there's no time frame for that. So I'm going to extrapolate and say there's probably not a definitive time frame for when you would get a booster shot if you've previously been vaccinated and you've had a breakthrough infection. My opinion just would be that I wouldn't probably do it any sooner than 14 days from the onset of the initial symptoms that you had for your infection. And given how immunity does tend to wane a little bit, I probably wouldn't do it any later than 90 days from the onset of your initial symptoms. So somewhere in that window, if it were me, it would probably be somewhere like a month to 2 months out from the infection that I would get that booster. Because I'd feel pretty good that I had some decent immunity right after the infection. But I'd want to get the booster to keep me going. Hope that helps. That was from last week and a question that was asked. Now yes, good question, Carrie. And I'm once it gets approved, I'm hearing that the government is actually going to, for what I'm reading, is going to roll this out a little differently than they did adults. And it sounds like they're going to push these vaccines, these Pfizer vaccines, to a lot of different offices. So I've got to think that we probably will at some point in time have that, like in the pediatricians and the family practice docs offices, but I don't have any details on how that's going to roll out yet, and whether or not the health department and or the hospital would consider doing any mass vaccination clinics and all those kind of things. So, or whether any schools will get involved with that. So I do know that the government is looking at this somewhat differently than they looked at the initial rollout for adults, which, as you know, was mainly like big centers, big immunization centers, health departments, our hospital, drive-through clinics, and I think they're going to do it differently. I'll keep that down on my list, and I know our marketing team will write that down for me to remind me, and we'll kind of be looking, and if we have more information next week, we'll share that with you. So other news that I thought would be interesting to share with you. So many of you may have seen this too, but Merck has a pill that's a COVID pill. If you get sick, you can take this, and so far at least the numbers are encouraging that it helps folks who get a COVID infection, much like Tamiflu does for people who get influenza. So I thought this was nice. I don't know all the motivation behind it, but they're willing to share their product information, how they manufacture it, sounds like, to nonprofits. So across the rest of the world that can be distributed once the FDA gives approval to their drug. So once the FDA approval happens, not here just in our country, but in other countries, sounds like an opportunity for patients who are sick to get help. That being said, I tell you what, that monoclonal antibody, it seems like from the people that I hear, it works pretty well for them. So we still have a really good treatment for folks who get sick with COVID who are at high risk in that monoclonal antibody treatment. Another piece of news, it's an article, research article that was done in Brazil, came out in the Lancet, which is a United Kingdom, kind of like one of their big medical journals. And it was on actually an antidepressant called fluvoxamine, which is, it's an old antidepressant that's been out for a long time. Anyhow, when they gave that to patients, it reduced their risk of being hospitalized from 11% for those who took it to those who didn't take it were 16%. So a little bit of statistically, they felt it was significant. This had to be given within 7 days of the onset of a person's symptoms. They don't know the mechanism, although there's some thoughts that perhaps that medicine has, with the receptors it binds, has some antiplatelet and or anti-inflammatory effects, but something to be mindful of. And I wouldn't be surprised if some of our docs are getting that information and considering that for some of their patients. Other news, and one of our viewers already asked this question about 5 to 11-year-olds. So Pfizer has gone through the hoop of the FDA, now has said thumbs up. It goes to the CDC, and they have to give their thumbs up. And then, of course, IDPH would have to weigh in too, which they usually just follow lockstep with what the CDC says. So it looks like that's most likely going to go forward, and looks like it's going to be for 5 to 11-year-olds. Other than I read the kind of the asterisk was except if the virus is spreading at a very low level, and then they would consider whether or not to do that because of the small risk of myocarditis. I think by and large, though, it's going to be a go, particularly where we're at right now with our pandemic. I think it's 91% effective in kids on the studies they've done so far with the kids who've been part of the trial. So that's encouraging, even with it sounds like even with the Delta variant. And remember this now, obviously kids are pretty unlikely to be hospitalized if they get COVID, or die if they get COVID. It's pretty low risk. However, They are, if they get it, they're out of school for a couple of weeks. And as we know, kids are, part of like the societal part of this is we know that kids interact with parents and other adults and grandparents and other grandparent like people who are at higher risk and do have health issues that they would not want to get sick from a young person. And we all want to be able to allow more freely for those 5 to 11-year-olds and younger people to interact with their parents, grandparents, aunts and uncles, all those kind of folks, particularly as we have the holidays coming up and that type of stuff. So I think it's a great thing that if we can get this going and rolled out for 5 to 11-year-olds. Other news, this was in the Lancet Microbe, which is another journal. So they did some studies, and even though there is natural immunity when folks get an infection, it does tend to wane, and it tends to wane pretty rapidly from rapidly from what this study came up with. So those people are more susceptible for reinfection, and they just recommended that all the more reason to get vaccinated, even if you've had an infection. Another fact, I forgot to mention this in the facts section. So the CDC came out with this, and they did a comparison of people who were hospitalized between January and June, which was the variant. I forget, it was at the Alpha. Anyhow, it wasn't a Delta variant. And then they looked at folks who were hospitalized between July and August, which had been primarily the Delta variant folks. And they didn't see any increased virulence. In other words, the virus wasn't any meaner or nastier. It didn't cause more hospitalizations and more deaths, which is good news. What it did do, and what it did show, though, was that in the 18 to 49-year-old category, with the previous variant, about 25% of that group of people were hospitalized, and it was 36% with Delta. So just that goes along with what we've been hearing and seeing in terms of the stats. That fits with that. Another piece of news is that this is more local news, but flu vaccine wise, we're going to do a mass flu vaccine for our employees tomorrow. And our pharmacy tells me that they have even begun to send out flu vaccines to our satellite clinics. Some of them have them now, some of them will have them soon. So we'll be able to give flu vaccines to our patients at our satellite clinics in the now or the very near future. So if you go to a satellite clinic, give them a call and they'll be able to help you out with when they think they're going to have that. Obviously, there are flu vaccines at a lot of retail pharmacies, and that's a great option as well. I encourage you just to get a flu vaccine. It is that time of the year where I think the timing is right. If you haven't gotten a flu vaccine, to go ahead and get that now. There are no issues from what the CDC has said that the timing of when you get a flu vaccine versus when you get a COVID vaccine or booster, no problems. So if I get a flu shot tomorrow, I'm a CGH employee. If I wanted to go to Walgreens the next day and get a COVID shot, no problems. So just keep that in mind as you kind of think about when you're going to get those shots. Mary, how do you feel about people wearing a mask while shopping? Should our business continue to follow the mask mandate? Yeah, for now, yes, Mary. I think it makes sense if you're in an indoor public place. I still think it's reasonable. There's a modest reduction in transmission with the mask. We still are in the pandemic definition of this situation. If it becomes more endemic, which is where there's kind of a low grade amount of infection going on, then I would think at that point in time, then we begin having more conversations about whether or not we can back away from that. So if you're a restaurant eating, okay, fine. But if you're just going shopping or something like that, I think it's reason. I follow that mandate. I think it makes sense. I think it decreases the risks of everybody for the rest of society. You just don't know who has something when you're walking around. Carrie asked, After COVID, can a kid get flu vaccine? Once again, Carrie, from what I'm hearing, this is for adults when the CDC gave this guidance, but it doesn't matter. From the adult standpoint, it didn't matter. The CDC would say, a kiddo can get a flu shot today. And if the COVID vaccine was available next week or 2 weeks from now, that wouldn't be a problem, at least for adults. I don't think that guidance is going to be any different for children. So that it's not officially out, but I think that's probably how it's going to go down. Thanks for the question, though. Okay. And then I had just my analysis part of that, part of this before I go on to some other non-COVID related things. So, and by the way, I appreciate the question. So if you have questions, if in doubt, ask me the question. I'll be glad to do my best to answer it. And if I don't know the answer, like we did this week, we'll come back next week and answer it for you. So I would say overall, I think things are looking positive. I'm encouraged with the direction that this situation is headed right now with this Delta variant. I, of course, have my fingers crossed in terms of there's Delta plus variant, but so far it hasn't gotten a lot of traction in terms of spreading, in terms of more percentages of that. So I'm encouraged right at this moment. Obviously, as we've talked about before, with these variants, the more people that get COVID, the more opportunity for the virus to tweak itself and change itself and come up with a virus that is different, and particularly something different that is more transmissible. So we'll see. I'm hopeful, but as we talked about before Delta hit, that was what we were hoping to. So I'm hopeful. I'm positive right now, and I just I guess my ask or my recommendation is just continue to help the rest of society as an individual. And if you're able to get vaccinated, it's still not too late to do that. If you're able to get a booster, if you fit within the requirements, and Matt's going to put those up, if you would, Matt. Yeah, so here's the eligibility for a booster shot. So 65 and older than 18 who live in long-term care settings, over 18 who have underlying medical conditions, over 18 if you work in or live in high-risk settings like healthcare. Basically, if you're exposed to the public on a regular basis. And if you receive a J&J vaccine, you're also eligible. And by the way, in the J&J vaccine, within 2 months after that vaccine, you can get a shot. It says when, 6 months after Pfizer and Moderna, 2 months after J&J. And then it says which booster shots. You can get whatever one you want. I wouldn't get a J&J booster unless you absolutely are like, I just want to do J&J and keep consistent with that. I think I would do one of the mRNA boosters. So far, at least, in terms of efficacy, this Moderna is the most effective. But I had a Pfizer booster, and I'm comfortable that at least I got my antibodies up getting that booster shot. So, and then Matt, we also have some information about what we know about some booster opportunities. Yeah. So we have it at our main clinic. And Whiteside County Health Department is offering them. You can see that. We'll have this posted so you can take more time to look at that. And of course, retail pharmacies, you just have to plug in and they'll tell you what they have and what opportunities they have to make an appointment for that as well. So thanks, Matt. Okay, now I'm going to give you some bonus medical information. So first of all, I thought this was an interesting study. It was about people who were trying to stop smoking. And they did the study and they compared Chantix combined with Chantix is a commonly prescribed medicine for people who are trying to stop smoking. And they combined that with a nicotine patch. And then they compared that to people who just did without just one and not both. And they also compared people who had that treatment for 12 weeks versus 24 weeks. Didn't make a difference. So if you're trying to stop smoking, you can either do a patch or you can do the Chantix, but you don't need to do both. And you only need to do it for about 3 months. My take home on that is these products help people who are trying to stop smoking, but you still have to have your mind made up that you want to do it. And if you have your mind made up you want to do it, those will help, but they don't take care of your mind wanting to do it. And then the second thing that I just thought was interesting that I would share with you, it was a study done, I think this was in JAMA, which is one of the big medical journals in the US. It's a Journal of American Medical Association. And they compared comatose survivors of out of hospital cardiac arrest. So people who have a cardiac arrest outside of a hospital. And we know that there's, what we try to do with those people is one of the things we do is try to cool their body core temperature down, because we think that helps to save brain cells if they survive that or in the hospital. And they compared cooling people down from either 34 degrees centigrade, which is 93.2 degrees Fahrenheit, versus 87.8 degrees Fahrenheit, to see if you cool people a little bit further, does it help more? It doesn't. So those kind of things fascinate me, how our brains and how the neurons in our brains and how they bounce back or don't bounce back, and what helps and what doesn't help. So I thought that was interesting and wanted to share that with you. And we're going to try to do that more and more as time goes by, because obviously as the pandemic becomes hopefully less of a thing, we want to continue to share with you medical information, things that are going on here at CGH, and things that might be helpful and interesting for you as you think about your health and the health of those around you. I saw a question pop up. If I could get that back up, Moxie asks, does CGH have the senior flu shot? CBS is out of it. I think so. Hey, while I'm talking here, if one of our marketing folks, here we go. Thank you. Our marketing team's on top of stuff. So there you go. We have it. Good question, Moxie. Appreciate that. And I did not know that local pharmacies are out of that. So, and if you are a senior, I would strongly encourage you to get that vaccine that has it's the super senior shot, because it'll improve your immune system's response to that better. So good question. Okay. Another thing I want to start doing, I tell you what, our team here at the hospital, our healthcare staff has been doing a remarkable job during this pandemic. And it's been a very unique time. And as you've read, it's not like our hospital or other hospitals are flush with just a lot of workers who are able to help out either. So our staff they're stretched thin. They're doing great work. And we have things that internally that we do to say, hey, thanks to our employees, but I want to start giving some shout outs to folks as we go forward regarding some of our employees. So first of all, I run into one of our viewers who's one of our employees. So Danielle Baker, shout out. Thanks for watching our broadcasts. And Danielle works in our pain clinic. So shout out to Danielle. This is respiratory therapy, sleep, and our facilities team weeks. So there's a national, the people declare a certain week a week. So respiratory therapy, sleep clinic, and then our maintenance folks, this is their week. And I just want to give a shout out to all of them and the work that they do here at the hospital. So thank you. And I also we have an employee of the month every month. And I thought, my gosh, we should be highlighting these folks to the public so we can sing their praises too. So Brett Royer is the October employee of the month. And so I just want to give a shout out to Brett and thank Brett for all his hard work. Brett works on our surgical floor, the second floor, and he is a nurse navigator. So what the nurse navigator's job is to try to make that transition for patients as they are going from being here in the hospital to being discharged, to try to help coordinate that and make that go smoothly for the patient. And Brett does a wonderful job with nurse navigator, his nurse navigator role here at CGH. So thank you so much to Brett, our October employee of the month. Oh, I see a pre-show shout out. Okay. Thank you, whoever posted that. I appreciate that. Just want to say that I definitely don't have all the answers. Definitely don't have all the answers. I'm trying to, in our hospital, we're just trying to give you, on behalf of the hospital, I'm just trying to give you all the information that I know and have. And I appreciate your questions week out in and week out, even if I don't know them, because it makes me have to think a little bit more. And as a staff, we sometimes talk about those questions. And so thank you. And I will continue to do my best to give you the information that I know and find answers to questions that I don't. Yeah. Brett does a great job. Thanks for that shout out. Oh, thanks, Donna. Appreciate it. Yeah. And I think, Donna, thank you, because I know you've been a loyal viewer, you watch us all the time. And thank you so much. Appreciate that. So until next week, stay safe, stay positive, take good care of yourself, and take good care of those around you. Thanks for watching.